Hello, my name is Madison Wentz, and I am presenting on the topic of the detection of drug abuse in sports for Chemistry 120 Lab for Professor DBK. So first and foremost, what is drug doping and why is it so popular in the sports world? The definition of drug doping is an athlete's use of illegal drugs or substances to enhance physical performance in order to gain competitive advantage over an opponent. There are many reasons an athlete would use illegal substances, and they vary from sport to sport, but the three common reasons include an increased physical performance, help dealing with mental stressors, and a faster recovery from injury. There are common types of drugs used, and those include androgens, also known as anabolic androgenic steroids. A common form would be testosterone. They increase muscle growth and bone thickness. They increase recovery time, and they also improve an athlete's athletic ability by 2 to 5%. The second is stimulants. These stimulate the central nervous system and increase heart rate and blood pressure. They increase endurance, alertness, energy, and aggressiveness, while decreasing fatigue and appetite. Common forms include caffeine or energy drinks, and in extreme cases, cocaine. The next is growth hormone, which is another hormone that has an anabolic effect on the body. It increases muscle mass and performance, but there are many risks that outweigh the good. The fourth is diuretics. These are used to decrease weight in athletes. They affect the fluid-salt balance, and they help in some cases with drug tests by using a masking agent in the urine. The fourth is a beta blocker, which decreases heart rate, blood pressure, muscle tremors, and anxiety. They block adrenaline in the body, allowing one to perform longer without getting fatigued. And the last is methods to increase oxygen transport. This allows athletes to increase the amount of oxygen in their blood that is allowed to get to the muscles. This increases physical performance. All of these have side effects that are short and long-term, but they cannot technically be confirmed due to the unethical factor of allowing somebody to be on these illegal substances, so all the short and long-term effects have to be assumed. This next slide shows a summary of all of the drugs prohibited for athletes on the World Anti-Doping Agency. These include the types that I just went over and examples of each type of those drugs. And the second table is the side effects for different substances, and many include dehydration, diabetes, an increase in cancer probabilities, nausea, vomiting, constipation, decreasing in concentration, and fatigue. Now for the history of drug doping in sports. Drug doping dates back before organized sports, when the Greeks used to use mushrooms and herbs to increase muscle performance. Gladiators also used this in ancient Rome. They used stimulants and hallucinogens to increase the intensity of their fights and prevent fatigue and injury. They even got so competitive to the point where they involved their horses into the drug doping by feeding them stimulants to increase their speed during the fights. In World War II, soldiers were given anabolic stimulants to increase their aggressiveness, alertiveness, and their endurance. The US, Germany, Britain, and Japan used this on all of their soldiers, and many deaths were related to their intake of these drugs. Due to the amount of deaths and the allegations of the soldiers using these stimulants, the National Olympic Committee decided to start drug testing for the Olympic Games to make sure there was a fair playing field. In 1968, there was the first drug test for the Olympics, and many athletes decided to drop out knowing that they would fail their drug test. Of the 667 athletes tested, 15% of the athletes did test positive, which led the NCAA Drug Education Committee to now start testing college athletes. In 1988, President Ronald Reagan banned all drugs that were for non-medical uses in the Anti-Drug Abuse Act. This banned all drug use for athletes and for criminals, and this banned the use of recreational uses of drugs. The last thing is the WADA in 1999. This is the World Anti-Doping Agency, and it came together to form standards that were consistent internationally. Now that we know the different types of drugs, it is time to find out how they are detected. Formal testing typically only occurs in organized competitive sports. In high school, the individual institute decides when and if athletes do get tested. At the collegiate level, the NCAA and the individual institute get to decide who and when athletes get tested. And at the international and national level, the WADA, the World Anti-Doping Agency, and other national organizations decide when and if all athletes do get tested. Finally, the different types of drug detection. Urine testing is the most effective type. A urine test can detect a substance in the body within the past 3 days. It detects for metabolites, which are created when things are metabolized in the body. The second is a hair test. This is the most effective, and it can detect a substance in the body within the past 90 days. It uses radioimmunosity, which detects specific proteins for each drug or legal substance to detect how much and which substance was used. The next is saliva testing, which is ineffective, but it works very quick. It can only detect things within 3 hours. And the final is breath testing, which is used for alcohol and drinking. It can detect for the past 13 hours, and it uses your blood alcohol concentration to detect how much alcohol has been consumed. In conclusion, there are many drugs and illegal substances banned from athletic competitions in order to ensure participants' health and a level playing field for all sports. Here's my reference page, and thank you for listening to my presentations, and if you have any questions, feel free to ask.